Hi, today I want to do a presentation about PPE, personal protective equipment for hospital-acquired influenza. In this presentation, I'm going to talk about an issue occurs in the hospital settings which impacts on both patient safety and a healthy workplace. There will be several peer-reviewed studies help to demonstrate the nursing role for addressing this issue. Furthermore, there are also several guidelines and legislations will be discussed to understand the responsibilities as a nurse when addressing this issue. There are 8 questions that I'm going to talk about in this presentation. First, what is hospital-acquired influenza? Why is hospital-acquired influenza a problem? What is being done? How can effective leadership contribute to this problem? Why is doing PPE important for patient safety and a healthy workplace? What type of PPE is required for influenza? What are the legal and ethical boundaries in doing PPE? First, what is the hospital-acquired influenza? Influenza is an infectious disease of the respiratory tract which caused by the influenza viruses. The hospital-acquired influenza can be understood as the influenza which is not present at the time of the admission but occurs in 48 hours or more after the admission. It can be transmitted from person to person when the distance between is less or equal to 1 meter. Experts believe that the main transmission route of influenza is by droplet, which means that it can be spread when a patient with influenza coughs, sneezes, or talks. So, why is hospital-acquired influenza a problem? Because it brings negative impacts on both patients and healthcare workers. Patients with hospital-acquired influenza will likely have prolonged period of hospitalization, longer period of being off work, or may die when severe. Therefore, patients may possibly end up with poor physical and mental health status. When the influenza transmits between the nurses would need to be on sick leave. The other colleagues who has not get transmitted need to work in an area where it's short of staff. It becomes additional pressure for them. The quality of the nursing care will be affected. Again, it will affect patient safety as well. What is being done? The valuable guidelines and strategies have been implemented in Australia. The Australian Guidelines for the Prevention and Control of Infection in Healthcare 2019 has been implemented to estimate and minimize the risk of further transmission of influenza by complying with the standard infection prevention and control precautions. There is also a guideline implemented for preventing and controlling the outbreak of influenza, which is guidelines for the prevention, control, and public health management of influenza outbreaks in residential care facilities in Australia 2017. How can effective leadership contribute to this problem? And effective leadership is essential for infection prevention and control. A good nursing leader plays an important role in reduction of risks of hospital-acquired infections as well as achievement of further quality improvement. The nursing leaders can use effective communication skills to focus on overcoming barriers and to directly approach the issue raised between the staffs or during the process. There are also some of nursing leaders contribute to implement their gained knowledge regarding the infection control, which includes the information about the influenza. For example, this book, The Rapid Infection Control Nursing, which written by a clinical nurse specialist in infection control and a consultant microbiologist. Why is doing PPE important for patient safety and a healthy workplace? The several effective methods can reduce the transmission of influenza in hospital include hand washing, healthcare workers vaccination, pre-vaccination of patients, patient isolation, antiviral treatment, and the use of facial mask, which can reduce 3% to 10% of transmission rate. Therefore, we can see that strictly adherence to the standard contact precaution and droplet precautions can effectively reduce transmission rate of influenza virus in hospitals. So, what type of PPE is required for influenza? The healthcare workers will need to follow the policies to apply the appropriate PPE in an appropriate way. As considered the way of influenza transmits, also according to the guideline, the droplet precaution needs to be applied for influenza. This type of PPE requires the nurses to perform hand hygiene and wear a mask before going into patient's room. However, when exposed to patient's body fluid or blood, gloves and gown will be required. There also will be the instruction put on the door of patient's room for all staffs to follow. There is also the picture of instruction to show how to put on and take off the PPE in correct order. What are the legal and ethical boundaries in doing PPE? One of the legal boundaries of doing PPE is the low compliance of nurses towards the use of PPE. The studies done by Powers 2016 have shown that one of the factors of non-compliance to PPE occurs due to the knowledge gap. Some nurses do not understand how PPE can protect them from the infectious disease, and they choose not to wear the PPE sometimes. It is important for nurses to understand and comply with the legislation. The Public Health Regulation 2012 stated that a health practitioner must adopt standard precautions for the control of infection in his or her practice. One of the ethical boundaries of doing PPE is some nurses choose to be more blind when witnessing an inappropriate practice. According to the studies, there are three-quarters of students, even nurses, have reported that they have witnessed the health workers failing to apply a proper PPE. However, they choose not to report it for avoiding the ethically challenging situations. So, how do we overcome these boundaries? For overcoming such legal and ethical boundaries as a new graduate nurse, we need to take the responsibilities below. First, we must monitor compliance with the policies and guidelines regarding PPE for nurses on implementation outcomes. Second, we must provide advice, information and support to managers and workers with risk assessment. Third, we must ensure the appropriate corrective actions are taken for all incidents related to PPE. In conclusion, the aim for this presentation is for my audiences to understand how the hospital-acquired influenza negatively affected patient safety and healthy workplace, to understand their responsibilities as a nurse to do an appropriate PPE, also to help them to understand their responsibilities and the ways to overcome the underlying legal and ethical boundaries. So, as a new graduate nurse, as well as a nursing leader or role model of nursing students, it is also our responsibilities to continue to study clinical knowledge and to practice our clinical skills, to promote compliance with standard and transmission-based precautions, to educate and to promote related information to clinicians, students, and others. This is my reference list. Thanks for listening. Thank you.